and your colleague, Representative Chip Roy, along with 20 other House Republicans, sent a letter to their colleagues urging structural Medicaid reform, if we could put that up. I interviewed Rachel Bovard from the Conservative Partnership Institute earlier on my radio program. She put up a little fact box this morning on social media, on X, saying more of the spending in Medicaid is going to able-bodied working age people. There it is, working age people in mostly good health, and not to single moms with infants and the people you thought this would be going to: low-income women, low-income children, single-family household, single parent households. When we talk about this, the Democrats keep saying that Republicans want to cut the services. No, they want to ensure that people who are getting Medicaid really deserve it.
Well, the other thing, Andrew, they're going to keep doing that. In other words, they're saying we're cutting Social Security. In reconciliation, you can't touch Social Security. They know that. It's a scare tactic. Cuts in Medicaid is that they define a cut as if the able-bodied Americans that should be working, that are above the poverty, well, not even, they don't have a job, they don't have any source of income. They define that as a cut. They define illegals that shouldn't be getting a check anyway as a cut. That's just not true. What should be examined is the 90% reimbursement rate that the federal government gives illegals and able-bodied men that should be working, should not even be on the payroll, as opposed to those who years ago got Medicaid and they got a 50 to 60% match. So they're going to keep saying that because they think it's a scare tactic that's worked in the past. It's not working now. And we're going to have Medicaid cuts, Medicaid readjustments, and we're going to have, and if they call that a cut, let them keep doing it but it's just not true.
For full shows, live and on demand, it's Salem News Channel.